I'm Atul Kaushal. I'm a physician, and I'm really glad to be here chatting with you today. Uh, I'm here as the medical director of AmourCBD, and I got here because I've always being a physician, I've always chased the idea of keeping people healthy, um, and in that pursuit, I've covered a lot of things from basic patient care through my consulting career and digital transformations and all sorts of human-centered design and complicated ways to keep people engaged and keep them healthy. One of the things I think that big business and large industry forgets sometimes is that we have so many ways to keep people healthy that are either yet undiscovered or have been shelved or have been for whatever reason have not been investigated. And so I actually left my clinical practice because I didn't feel that the clinical community was actively engaged in the pursuit of healthcare. Back in the day, I would say that it was more sick care, right? And and my to take a step back, my parents are physicians as well. My mother's a pediatrician, and she worked with a pediatric neurologist whose name was Dr. Vukovic, and which I didn't know. We discovered this later. More recently, my wife, as a physical therapist, was working with Marianne Vukovic, who's also a physical therapist, and that's how I met some of the people on our team here. I got to know what they were doing, and it really struck a deep chord inside because I realized that this was a grassroots movement of people taking charge of their own health, which is really the only way to do it. We when you can empower someone to make the right decisions, and they could be guided decisions, and that's why people like me are around to help guide. But when you can empower someone to take care of their own health care, that always produces the best outcomes. And that, you know, oddly enough, that's the end goal of all of the quote unquote fancier solutions, all the all the apps, all the meditation apps, and all of the things that you could see on your smartphone. That's the healthcare system asking you to take charge of your own health. Meditate when you feel like it, stand up, take a break, breathe deeply. That's all you taking charge of your own health. And so when John explained what they were doing, I immediately thought that this was a great idea. I volunteered to help, and as we got into it, I just got closer and closer, and here I am. Being a proponent and a believer in wellness and in other other modes of therapy. Let's put it that way. I wanted to see if what AmourCBD was producing really cut the muster. And as a scientist and as a physician, I wanted to see the results before I kind of jumped in with both feet. And the person I know who's in the most pain, unfortunately, is my mother. She has degenerative joint disease, and she's a little elderly at this point, and her shoulders hurt and her knees hurt, and recently she just got a walker because she's in quite a bit of pain pretty much throughout the day, and she's starting to have trouble sleeping. My brother is also a physician, and so we've been, over the last couple of years, we've been trying different things to help her be more comfortable. And so when when I decided I wanted to get involved with AmourCBD, the first thing I did was to take the pain relieving cream and give a tube to my mother. Now, mom has been taking 3 very powerful pain medications so that she can get through her day. There are non-steroidal anti-inflammatories, and then there are some things that are more centrally acting. So they also have they make her sleepy, trouble getting out of bed in the morning, a little unstable on her feet. One of the doctors prescribed even like a muscle relaxant. So a very strong combination of powerful pharmaceuticals that, while they were doing the job of masking her pain, the side effects were very difficult to manage. And not only the side effects that she could observe, but for example, non-steroidals are terrible for your kidneys. I mean, so there are internal damages that happen as well. And so I gave her. Long story short is I gave her a tube of the AmourCBD, and I was just checking with her every couple of days. How you doing? How you doing? How you doing? And about a week later, when I called her and I asked her, and I could hear in her voice that she was smiling, and she reported that she was able to, over the course of the week, that she was able to reduce her prescription medications by half. She was able to get out of bed in the morning. She was no longer unstable on her feet. Her mental fogginess had cleared, and she was delighted. She's also a physician, so she knows what these drugs are doing to her, and she was delighted that she could cut them back in half. And then shortly after that, she asked me for her second tube. And when that happened, when my mom, who is skeptical of everything, especially any business ventures that her young little son gets into, right? When she asked me for the second tube, my confidence became a certainty. I'd like to, maybe that's an easy way to say it. I was confident, but then I was certain, and that transformation really kind of made the difference for me. And then I could very comfortably, without any holding back from inside of myself, I could jump in with both feet. I really believe in what we're doing here. The doses that are well tolerated, up to about 1,500 milligrams of CBD a day, are well tolerated. Our AmourCBD is a topical, which, although it's absorbed partially, you're not going to get anywhere close to that 1,500 milligrams. So it's extremely safe. About 60% of people who currently use CBD take it for anxiety, but pain is the number 2, followed by insomnia and a couple of other things. The FDA, as well as the WHO, which is the World Health Organization, have both stated that they don't believe that CBD poses any public health risk as compared to some of the other substances, especially like, say, opioids, right? And the WHO has gone as far as to say that they believe that there's very low or negligible addiction potential for CBD. So, which are all fantastic things. I mean, you have the U.S. regulating body, and then you have the World Health Organization. So those are 2 powerful allies to have in this effort. And then the CBD interacts in our body with our endocannabinoid system, which regulates things like mood, appetite, behavior, sleep, and it's largely been unexplored. Unlike some of our hormonal systems and our some of the other systems in our body, our immune systems, which have been thoroughly studied, and we've developed fantastic ways to cure or treat illnesses within those systems, right? The endocannabinoid system has not been explored because cannabis has been a Schedule One substance. So I'm super excited because the possibilities as we actually apply scientific methods and clinical studies to the endocannabinoid system, I think that the benefits and uses of CBD will just continue to grow. Another unique feature of AmourCBD, when we're talking about the pain relieving cream, is the combination with lidocaine. The two substances work synergistically, which means that 1 + 1 = 11. And so the lidocaine facilitates the efficacy of the CBD and vice versa. And that's why when you look at a bottle of AmourCBD pain relieving cream, you'll see that it may have 200 milligrams of CBD in it, compared to you may see something on a shelf that has 1,000 milligrams, right? But the combination of the CBD with the lidocaine actually makes this orders of magnitude more effective than pure CBD alone. So that's the other, aside from the mission, the FDA registration, this combination is actually one part of the secret sauce. And while the lidocaine plays primarily a pain relieving component, the CBD actually plays a couple of different roles. One is directly in the pain relief, but another yet to be explored or yet to be verified, but anecdotally verified, is that CBD has tremendous anti-inflammatory properties, which means that it's very effective at reducing inflammation, either orally, if you take it orally, and that'll reduce inflammation in your whole body, but locally. So if you have a local arthritis or a local pain, then the CBD is very effective at reducing that inflammation as well. One of the things that I've always gone into the world with is that, especially in this pursuit of having a better understanding of how to keep people healthy, is most attempts, whether they're by the government or by hospitals or by healthcare, by payers, most of the attempts have been through technology. Most of the attempts to keep people healthy have been through technology. And my belief is that in addition to the ones and zeros, right? What we really need are X's and O's, right? We need X's and O's instead of ones and zeros, and that idea of empathy and understanding what people are going through and trying to do the right thing, and that's kind of the differentiator here, because the force behind AmourCBD is a retired nurse who came out of retirement for love, and that we didn't have to be here. The whole effort is an effort, is a moral effort out of the love for people, and what I've been chasing in my career for 20 years, and what our founder came out of retirement to do, has brought us onto the same path. And that's really what differentiates AmourCBD, is the mission, period. Below that mission, we have the FDA registered NDA number, which means that what's in the bottle, what's on the bottle is what's in the bottle, and and the combination with lidocaine as from a clinical standpoint makes it highly effective. So, really, when you put it all together, we have a company born out of love that has developed a high quality, highly effective product that we've taken the pain to make sure that it's safe, and we've tested its efficacy. So I mean, it's really, it's really a gift.